Hi, Dr. Goodwin. How are you?
Okay, how are you, Dr. Corser?
Very good. Good to talk to you.
Good. I just want to tell my Health Power audience that I'm having the pleasure today of talking with you as the medical director of the Sleep Management Institute, and that we're going to be talking today about safety, it's National Safety Month, and the relationship to the amount of sleep people get.
Yes, very important topic. So it turns out that people really need adequate sleep to function well during the day. And lack of adequate sleep has profound adverse effects both on our brain and on our body. So we really need to achieve that good, uninterrupted sleep throughout the night.
Now, although I'm sure there's no one answer, what is the minimum amount of sleep that most people need nightly?
So, the average recommended amount of sleep for adults is between 7 and 9 hours. The amount of sleep that a person needs is really genetically predetermined. So, we can't really alter our genetic destiny. So some people do well on 7 hours, some people need 9 hours. So it really is individual. But that's really the sweet spot, 7 to 9 hours a night.
Okay. And I understand you have been participating in the 30th annual sleep conference in Denver.
Yeah, so there was a very interesting paper presented at the sleep conference. So it looked at various sleep medications. It compared a medicine named Silanor, which is used to help people sleep through the night, and that was compared to a sugar pill and Zolpidem, better known as Ambien, which is the most common sleep aid prescribed on the market. So the results were very surprising. The participants in the study that took Zolpidem when compared to sugar pill exhibited marked decrease in their ability to awaken during the night in response to a noise played in their ears. In fact, on average, the participants in the study that took Zolpidem required 103 decibels to awaken, and 64% of the participants required exposure to 110 decibels to awaken from sleep. That's the equivalent of a chainsaw 3 feet away from the head. So this is a very surprising finding. In addition, participants that took Zolpidem exhibited marked impairment in memory, walking, and balance when awakened during the course of the night. When Silanor was evaluated, it did not separate from sugar pill in terms of its ability to allow people to awaken during the night in response to noise. Furthermore, it did not impair memory or balance or walking through the night. So this is a very important finding because people that get up during the night, they may stumble and fall. So we didn't see these issues with Silanor. So Silanor seems to be very effective in allowing people to sleep better throughout the night.
So let's just compare again. One was Silanor, one was the sugar pill, and what was the third medication?
Silanor, sugar pill, and Zolpidem, which is Ambien. And the Zolpidem really caused marked impairment, whereas that was not seen with Silanor.
I see. That's very interesting to know. Would you say this is one of the major findings or presentations at the conference?
Well, this was certainly one of the more interesting findings. We've known for a long time that insufficient sleep has, severe negative consequences on people and their ability to function. And this study points out that there's really very marked differences between various sleep medications. And it's important that practitioners prescribe the right sleep medication for specific individuals with different needs. Silanor seems to be very effective in allowing people to sleep longer and better throughout the night without some of the baggage associated with some of the other sleep medications.
I see. That's interesting. And also, as I understand it, there is a correlation between sleep and mental and physical health.
Absolutely. You know, sleep is one of the three pillars of good health. You know, there's diet, there's exercise, and then there's achieving adequate sleep. And really, if without adequate sleep, it's difficult to maintain good health, both mentally and physically. So you're absolutely right. Achieving adequate amount of sleep for your own individual needs is very important.
Okay, and the study that you were talking about, I gather, is the one with the three different. Is it sort of like a clinical trial study?
Well, it was not exactly a clinical trial. It was the Silenter has actually already been approved by the FDA, but the study points out that there are very different properties between different sleep aids. So, for example, if you look at over-the-counter sleep medication, some of the over-the-counter medication includes either diphenhydramine or doxycycline, both of which are antihistamines, but they really can cause fairly significant next-day impairment. And you know, they can also cause memory difficulty, urinary retention, constipation, a lot of other side effects. So you know, it's important that people realize that taking some of these over-the-counter medications may not be very good, and they may want to seek healthcare professional advice regarding the best medication for them.
So how's the best? Where's the best place to get the best advice or make the best decision on sleep medication?
Well, you know, primary care physicians certainly are capable of prescribing various sleep medications, but other doctors such as sleep specialists, internists, geriatricians, all of these doctors are very familiar with the various sleep medications that are available. So I encourage people to seek counsel if they're really suffering from insomnia.
Okay, I'm going to ask you two other things. I understand that about 10%, or 1 out of 10 people, have chronic insomnia. In other words, difficulty sleeping through the night, according to the National Sleep Foundation. Is that correct?
That's absolutely correct. That's right.
Okay, so that's a very important thing for us to know. And there was one other thing I wanted to ask you about in terms of the research, but I think I caught that. So as far as home life is concerned, as far as work life is concerned, and as far as driving and such things as that are concerned, having adequate sleep is extremely important.
Absolutely. You know, there was one study that evaluated people's driving habits, and it turns out that about 60% of adults admit to driving while drowsy, and about 37% of adults have admitted to actually dozing off behind the wheel at some point during their life. So this really is a big problem. So yes, people should be very cautious and not drive if they do feel drowsy. And if they have a chronic sleep disorder such as insomnia, they really should seek medical attention for that.
Okay. And the Sleep Management Institute, does that have a web address or something that we can have people go to if they want more information?
Yes, you can search the Sleep Management Institute, or you can go to silenor.com. That's SILENOR.com, silenor.com.
SILENOR.com?
That's correct.
Or to the Sleep Management Institute. And the Sleep Management Institute.com or .org?
If they just search that, they can. That's the
It'll
institution where I work. But silenor.com has the information regarding that medicine.
Right. Okay. All right. Well, I certainly appreciated talking with you, and I'm sure my Health Power audience learned something important to know about the importance of sleep and adequacy of sleep.
Well, it's very nice to talk to you. Thank you so much.
Okay, you too.
All right, take care.